Hi there. If you're watching this video, I've probably directed you here because I have recommended IV therapy for you. And this video is just a short synopsis of why IV therapy is important and what IV therapy is. So IV therapy is administration of various nutrients that are natural to the body. Could be vitamins, minerals, amino acids, antioxidants, um, or even chelating agents in higher doses than the digestive tract can absorb. So the reason I'm probably administering IV therapy for you is because there is some sort of digestion issue where your absorption levels are not up to par, or there's a severe enough nutrient deficiency that I feel that IV therapy is warranted, meaning we want to get you such high doses of these nutrients that I recommend an IV route of administration. The benefit of using IV therapy is that it totally bypasses the gut. So any sort of rate limiting factors that are dependent on our absorption through our digestive tract is circumvented with IV therapy. For example, vitamin C is a fabulous antioxidant. It's found in a lot of fruits and vegetables, but unfortunately, in extremely high doses, it can cause irritation to the gut and loose stool and discomfort. So we can only take about 3,000 milligrams of vitamin C orally on a daily basis. But if we take IV vitamin C, we can take much higher doses, up to even 30,000 milligrams of IV vitamin C. So as you can see, right there is a perfect example of how IV nutrient therapy can really be beneficial. Now you might ask, why would I need such high doses? I'm not that sick. But the answer probably lies in something in your health that we have determined is not working optimally. Unfortunately, over the past several decades, our soils have become more depleted and therefore our food has become more depleted of nutrients. So even healthy individuals who eat a standard American diet can suffer from fairly severe nutrient deficiencies that need to be addressed. And IV therapy is a quick and effective way of addressing those deficiencies. We could continue to pile your plate high with fruits and vegetables, which I still highly recommend, but unfortunately we're not necessarily going to get to the bottom of this deficiency, and it will be a slow, steady increase in those nutrient levels. Whereas with IV therapy, we can quickly accelerate that and get you back up to feeling like your best version of yourself more quickly. So what are some of the things to expect with IV therapy? First of all, a lot of the results are subtle, meaning that this is not a therapy that's going to leave you jumping out of your seat like you just had a big shot of espresso. It's slow and steady. This is working on your foundational levels of these nutrients, which means that we're looking for foundational shifts in your health. People report to me, I'm just feeling more like myself, or family members, loved ones are telling me I'm acting more like myself. You might notice that your stamina improves, where you can carry out activities later in the day without fatiguing, or that you're waking up with more clarity of mind. These are all signs that the IV nutrients are starting to do their job for you. So it's going to be subtle. The other thing is that depending on how deficient you were to begin with, can sort of limit how quickly the therapy works for you. If you're severely deficient, 1 or 2 IVs might not result in much effect. It's going to take a series of them, maybe 5, 6, or 7, depending on the IV therapy you're receiving and the treatment plan that you and I have agreed on. Then there's also the question of side effects. What can I look for? What could I expect from this IV that I might not want? The number one side effect from these IVs is headaches, which I generally attribute to dehydration. Even though you're getting a lot of fluid put into your body, these fluids can actually be slightly dehydrating because what we refer to as the osmolarity of the bag, which is how much stuff is in there, is very high because I'm packing it full of as many nutrients as I possibly can. But for that reason, it's actually slightly dehydrating to the system, which means you need to drink a lot of water before, during, and after your IV therapy treatment. Additionally, you want to come having eaten plenty of food. Come with a snack if you know you're someone who gets hungry easily, and plan to eat shortly after your IV again. I generally recommend that those meals include a good amount of protein, at least 10 to 20 grams of protein, and that they have some carbohydrates in them. So maybe some slices of apples and some nut butter and then a hard-boiled egg would be a good example of a snack before your IV in addition to your regular meals for the day. This is important because we want to keep your your blood sugar stable throughout the IV treatment. Um, the number one issue with vitamin C is that it mimics insulin in the body and it can make you feel like your blood sugar is dropping even though it's not actually dropping. You can feel a little bit upset stomach, a little lightheaded and tired, and we don't want that to happen. If you eat some protein before, you'll be fine. And if you start to feel that way during the treatment, just let us know and we can get you a protein snack right away. There are other various IVs that we administer, more specialized IV nutrients. If you're specifically receiving a different IV therapy, look in the drop-down menu for other options that pertain to the specific IV that you're receiving to get more details. But this is a great general overview of IV nutrient therapy. I hope this information was helpful to you. If you have any other questions before your visit, feel free to contact the office. They'd be happy to help you, or you can shoot me an email. Otherwise, I look forward to seeing you for your IV therapy treatment here soon. Thanks so much. Cheers and good health to you.